1.
This is Priti Saboo of the Johnson Group, the New Zealand Public Sector Recruitment Specialist. And today we have with us here Anne O'Connell, who is the National Program Manager Primary Care at the Sector Capability Implementation Unit with the Ministry of Health. Welcome, Anne. It's lovely to have you with us here.
Thank you.
And we would like to start by asking you to tell us a little bit about yourself. Why did you join the Ministry of Health and what are you enjoying about your role at the moment?
Thank you. Well, I started life as a nurse, so I have a health background and did quite a bit of clinical and education training of nurses in my background. And about that, later in my career, decided that I needed a change and looked to policy and decided that the area that interested me most was purchasing or buying services for people who needed health services.
Right, okay. And your current role, what are you enjoying currently at the Ministry of Health?
So currently I am looking after the primary care team. I also have a strategic side to that where I am looking at programs that we can develop in primary care that improve access and outcomes for people in primary care. So I've worked in that role for about a year.
Right.
And prior to that in the ministry I was looking after the disability team.
Right, okay. And about the primary care team, and what does it actually do?
The primary care team mainly looks after the services agreement between the DHBs and the PHOs.
Right.
So there's a lot of monitoring and administration around that. We need to look at fees and we have ministerials and other OAAs and things, the normal things that a ministry would have.
Right.
And we also look at some of the development that can go on in primary care. So one of the exciting parts of the role is that we are looking to align this contract with some of the other contracts in primary care,
right,
like pharmacy and aged residential care.
Right, okay. So this sort of beautifully leads us to the next question. What is on agenda for the next 6 to 12 months in your team, Anne?
Right, well of course we're getting a new minister, so it will depend somewhat on the direction the new minister would like to take.
Right.
But we do know that we need to implement the new under-13s policy,
right,
which will improve access for school-aged children to general practice.
Right.
We are also supporting a number of other projects to do with IT changes,
right,
which will help providers get better information about their patients, be able to do things quicker, and also for people to be able to access information about themselves.
Right, okay. And about your current team, Anne, I mean, what is the background of these people? Do they come from any particular discipline?
There are a range of disciplines in the team and across the wider team, which includes the immunisation team and the child and family team.
Right.
And these include, a lot of them come with health backgrounds, but there are some that have the broader social service background.
Right.
There are some that have pure science and have wanted to change in direction.
Right.
And there may be some that, it's not unusual to have people that may have started life with a law degree or something like that. So.
Right, okay. And we know that you are hiring, you're looking to hire an advisor and a senior advisor in the team.
Mm-hmm.
So do you want them to have any particular skill sets or do you want them to have any specific experience or background?
Well, ideally it is always good to have health background. It does help in the area, but it's not absolutely necessary. But some experience of primary care and the primary care secondary interface would be an advantage. However, we're really looking now for people that want to make primary care their new passion, their change in direction, perhaps for some people that have worked in health before. Obviously important will be writing skills, being able to conceptualise, but turn concepts into practical ideas, and really want to stay in the area and work with primary care in the wider sector for a wee while.
Fair enough, okay. And in terms of why would people want to come and work in the primary care team? What's in it for them?
I think this is a great opportunity to learn a new area. They would be well supported. We have a number of senior people that we could provide a good induction program with. We have, I think, working with the primary care team that works alongside some of the other teams is also a good opportunity for people to see what else is available in the ministry, should they want to stay in the ministry for a number of years.
And what about the fun part? Does the team have fun?
Oh yes, there's lots of fun. We always have morning teas, and there's a lot of baking that goes on.
Oh, wow.
But when we recently, across the whole of the unit, celebrated Talk Like a Pirate Day, where everybody dressed up as pirates and spoke like pirates for the day. So that was very much a lot of fun.
That's fantastic, absolutely. It does sound like interesting, challenging work programs, lots of variety, lots of opportunities to learn new things, and a lot of growth opportunities. And you also have a lot of fun along the way. I think that's just brilliant.
Good work-life balance. We try to make sure that people can do what they need to do to continue their life outside work, and we're happy to work together to facilitate that.
Fantastic, brilliant, awesome. If you would like to know more about this opportunity, please contact us. The contact details of the Johnson Group are mentioned below. It's really lovely to have you with us today, and thank you so much for finding the time to do this small interview with us.
Thank you.
Thank you.